So turning to Part 3, what an individual with other health coverage should consider before they delay Medicare enrollment. This section will look at various types of coverage and the impact of delaying enrollment. Because I want to focus on types of coverage transitions, I will mention when penalties may apply, but this webinar does not address penalties. Be aware that enrollment penalties for individuals under 65 are no different than penalties that would apply for people age 65 or older. And these are the different types of coverage that we'll look at today in the webinar. Group health plans, COBRA, TRICARE, VA coverage, other coverage, and marketplace exchange plans or qualified health plans. Georgia will discuss Medicaid in the next section of this webinar. So looking at Medicare with group health plans and looking initially at large group health plans. Again, as a threshold with group health plan coverage, the coverage must be based on someone's current employment in order to defer enrollment into Medicare. So a large group health plan for those under age 65 is defined as 100 or more employees or part of a multi-employer, multi-employee group, such as a union, where at least one employer has 100 employees. With large group health plans, that large group health plan will pay first and Medicare second. And as a notation, I would notice the difference here between people who are under 65 and over 65, because if an individual is 65 or over, 20 or more employees would trigger Medicare to pay second. So usually, a person may delay Part B enrollment if they have a large group health plan. There is a 7-month DSEP, which is a disability special enrollment period, when current employment status ends, or possibly when the large group health plan is no longer paying as the primary payer. A couple of notes here. The test for 100 or more employees is that in the previous year, at least 50% of the time, there were at least 100 employees. And another note, if a large group health plan becomes a group health plan for a year, so say, for instance, in that case that there was 99 employees and it dropped the previous year, and it dropped back into a group health plan and not a large group health plan for disability purposes, then Medicare would be considered primary because they're no longer a large group health plan. And if that happens, the individual should check with their employer to see if they have to enroll in Medicare Part B. In several of these slides, when I'm talking about group health plans, I am indicating that the individual should check with their employer. It's critical to check with the employer, and I will show you why in a minute, but just know that if possible, that information from the employer should be in writing. So looking at a regular group health plan, so not a large group health plan, and coverage again must be based on someone's current employment. And when I say someone, that would either be the individual themselves or possibly a spouse, and in some cases there are dependents that are considered to be grandchildren, children, or grandparents. So the individual would know, hopefully, that they have a group health plan of some size. So a group health plan for those who are under the age of 65 is considered less than 100 employees, right? We just talked about large group health plans being 100 or more employees. A group health plan is less than 100 employees. And in that case, Medicare pays first, and the group health plan pays second, again for those who are under 65 and disabled. So here's a caution. If the group health plan is paying secondary, an individual may need to enroll in Medicare Part B before the group health plan will pay, and the individual should check that with their employer. Here's another caution. If the group health plan is an HMO or a PPO, and the individual goes outside the plan network, it is possible that neither the plan nor Medicare will pay for that out-of-network care. the individual should check with the employer. For an individual with end-stage renal disease, upon eligibility for Medicare, any group health plan pays for the first 30 months. So there's no limit on the number of employees. If it's a group health plan, it could have 2 employees, and there's no current employment requirement. So it could actually be retirement coverage in a group health plan. Medicare will pay for end-stage renal disease after the first 30 months. And here's where I asked you to kind of put a pin in it and hold the thought about making sure that you get something in writing. Because there is something for people who have disabilities, people who are getting Medicare under the age of 65. There's something called equitable relief, which would equal a waiver of a penalty. So if a disabled beneficiary is misinformed about whether a group health plan or a large group health plan should be the primary payer of benefits, and is misinformed by either the federal government or its agents, for example, Social Security or a Medicare contractor, or if they're misinformed by an employer or by the group health plan or the large group health plan, a special enrollment period may be granted to correct the results of incorrect information. Again, I just wanted to mention here to reemphasize the fact that under age 65, with a group health plan of 100 or more employees or multiple employee plans, the group health plan will pay first. And age 65 or over, a group health plan with 20 or more employees or multiple employee plans, the group health plan pays first. Medicare with COBRA. COBRA is considered continuation coverage in order to keep a group health plan for a limited time after employment ends. So here we see that COBRA is a coverage that's not based on active employment or current employment. COBRA is usually available for 18 months or up to 36 months in some cases. And COBRA may be a good option for people who are under the age of 65 to bridge the 24-month waiting period to Medicare. And again, the 24 months, which is in reality usually at least 29 months, if not longer. But the cautionary tale here is not to assume you can have COBRA for the full 36 months and then transition to Medicare without a penalty. The enrollment window is month 22 to month 28 after a person is receiving Social Security. This is also known as month 27 to 33 from the date of the onset as determined by Social Security. So COBRA may be used as one of the only options for people under 65 with a pre-existing condition in the past. But now an individual should explore a qualified health plan option through the marketplace exchange to bridge that waiting period to Medicare. Another caution, an individual with COBRA must enroll in Part B Medicare in their initial enrollment period or face a possible Part B enrollment penalty and loss of Medigap open enrollment protections. Again, watching for sure, knowing for sure when your open enrollment period is and not missing that window. If you're disabled and you are still covered by COBRA and you are receiving Medicare, Medicare will pay first and COBRA will pay second. An individual who has end-stage renal disease and has COBRA, upon eligibility for Medicare, the COBRA will pay for the first 30 months and Medicare pays thereafter. A few more COBRA cautions because we get a lot of calls on COBRA. When an individual loses employer coverage and has Medicare, he or she should be aware of the time frames of the following. When is the COBRA election period? When is the Part B enrollment period? And when is the Medigap enrollment period? And as we've discussed, these may all have different deadlines that overlap. And what you decide about one type of coverage, either COBRA, Part B, and Medigap, may cause a person to lose rights under other types of coverage. Let's turn now and look at TRICARE. Who gets TRICARE? TRICARE is coverage, health coverage for uniformed service and their families, National Guard and Reserve and their families, survivors, former spouses, Medal of Honor recipients and their families, and people who are registered with the DEERS program. TRICARE pays for care in a military hospital or by a federal health care provider. Here's a caution that an individual with TRICARE must enroll in Part B Medicare if their initial enrollment period, or they could face a Part B penalty. So when enrolled, Medicare pays first outside the system of a military hospital or a federal health care provider, and TRICARE will cover Medicare deductibles and co-insurance. But oftentimes if you see Medicare paying first, that's the key that you may need to enroll in Part B or face a Part B enrollment penalty. Looking at Medicare with VA coverage. So an individual may use either VA or Medicare to cover their expenses, but not both. The VA pays when an individual goes to a VA facility or if the VA authorizes the services to be performed in a non-VA facility. Just a note on this, if an individual has something called a VA fee basis ID card, and quite a number of people who are eligible for disability benefits under the age of 65 and Medicare have this fee basis ID card. He or she may use a listed provider on a list that's provided through the VA, and the provider must accept VA payment as payment in full. They are not to bill Medicare and they are not to bill the individual. So who gets a VA fee basis card? Individuals with service-connected disabilities, individuals who need medical services for an extended period of time, and individuals who live in areas where there are no VA hospitals. And just a few notes on Medicare with other coverage. And again, hopefully these slides will be useful resources for you when questions come up in the future. But for people who have workers' compensation and no-fault liability insurance and federal black lung benefits, those programs will pay first for the services that are related to those programs. So either a workers' compensation claim or an accident under the no-fault or liability insurance, or if someone has services that they're receiving for black lung benefits. And Medicare will pay second on those types of claims, but Medicare pays first for all non-claim or non-accident related services, or in the case of black lung, non-black lung services. So again, be careful when Medicare is paying first that the individual checks to make sure that they will not get a Part B penalty. And finally, looking, at least in this particular section, looking at Medicare with a qualified health plan. Individuals who are under 65 and who are auto-enrolled into Medicare at month 25 after receiving Social Security or railroad benefits, and again, ALS would occur at month 1 and not at month 25. But individuals who are coming from the marketplace exchange plans, the qualified health plans, will lose qualified health plan tax credits and reduced cost-sharing benefits at the time they become eligible for Medicare. And another caution, because as we know with Medicare in open enrollment, there are automatic disenrollments. This is not true in qualified health plans that are obtained from marketplace exchanges. There are no automatic disenrollments from a qualified health plan. The individual must give affirmative consent to disenroll from the qualified health plan to discontinue that coverage and that payment liability. Looking at individuals under 65 who have no auto enrollment into Medicare and they're eligible to receive premium-free Part A. Again, enroll in Medicare at the initial enrollment period, or there may be late penalties. For those folks, again, there's no auto enrollment into Medicare. They lose their qualified health plan tax credits and reduced cost-sharing benefits at the time of eligibility for Medicare. And they must affirmatively disenroll from a qualified health plan in order to discontinue the coverage and payment liability. And this is an interesting slide. An individual under 65 with no auto enrollment into Medicare and not eligible for premium-free Part A. This may be a unicorn because we've at the center have not been able to identify any particular individual that this might apply to. But in the event that you have someone who is not eligible for premium-free Part A and is under the age of 65, the important thing, of course, in enrolling when they should enroll in order to avoid late penalties is that this particular scenario, the individual would not lose tax credits or reduced cost-sharing benefits unless he or she enrolls in Part A. So people who are voluntary enrollees into Part A and have that credit, have that coverage, would not be penalized by losing their tax credits unless they choose to enroll in Part A. Again, everyone must affirmatively disenroll from a qualified health plan in order to discontinue their coverage and their payment liability. Another note that qualified health plans are underwritten on age, gender, tobacco, and geography, but not on health status. So as we mentioned about COBRA, that COBRA seemed to be one of the only options for people who are stuck in the waiting period for when they become disabled to when they can qualify for Medicare. That time period may be now another option here for them is to obtain a qualified health plan from the exchange because there are no pre-existing condition limitations on a qualified health plan. So this at least gives people another option in terms of being able to fill that gap for coverage.